Basag is there. Dr. Som is going to present graft rejection in DMEK during COVID-19 pandemic years. Comparative analysis of 1200 consecutive case eyes.
Good evening, everyone. So I'll be sharing our data and some observations about graft rejection patterns in DMEK with COVID. I have no financial interest. So we know that graft rejection in DMEK is less, and stopping steroid is the major risk factor for having rejections. But during COVID, we started noticing more DMEK rejections, and also there were publications in that place. So formally, the purpose is to formally look at the data and look at the incidence risk factors and the clinical outcome of the graft rejections in DMEK that happened during the COVID period. So this is a retrospective interventional case series of single surgeon performed DMEKs. And the selection criteria is at least 3 months follow-up during follow-up after surgery. We took all the patients with rejection episodes, and from them, we further selected the patients who followed up for at least 3 months following the rejection episodes. So the study parameters was the reversal of rejection, failure, resurgery, risk factors, and how the endothelial cells looked. So this is how it is grouped. So group A is basically rejection happening during COVID, which is further subdivided into group A1 and A2. In A1, the surgery is done in the pre-COVID period, defined as from June 2016 to March of 2020. In group A2, both the surgery and the rejection is happening during the COVID period. So this is defined as from April 2020 to December of 2022. And group B is our control group, where the surgery and the rejection episode both happened in the pre-COVID period. Rejection was treated medically, and if it did not clear up by 3 months, it was labeled as a graft failure. And the statistical analysis was done using R. So this is a very busy slide. I'll just go over it. So preoperatively, there is no age and gender difference between the two groups. And also the surgical indications are again similar across both the pre-COVID and the COVID group. So now if we look at the bottom slide, so this is inter and subgroup analysis. So in the pre-COVID, where the surgery and rejection happened in the pre-COVID period, the rejection rate is only 1.5%, but it's more than 5 times higher in the rejections happening during COVID. In the subgroup analysis, where the surgery was done before COVID and the rejection happened during COVID, that is 15% rejection. However, both surgery and rejection during COVID, that is 3%. And what we found out that the highest risk factor here is basically a combination of stopping steroids and COVID infection happening together. So stopping steroid alone or COVID alone did not have as much as an impact. Vaccination, the numbers were far few to make any significant clinical importance. Most of the graft reversed, and regrafts were required in about 20% cases in both the groups. And in terms of the visual outcome, after rejection and after reversal of rejection was again similar in both the groups. But the risk factor here, if we take the odds ratio, was highest in group A1, which is they were like 11 times more likely to have a rejection compared to the preoperative control group. So in discussion again, most of our rejection spikes matched the COVID incidence or the lockdown periods. And again, this is supported by publications about more solid organ donation and also graft rejections in vaccinated individuals. And the causes might be multifactorial. One is temporary non-access to steroid drops or non-access to a doctor also. Then COVID infection itself directly or due to an alerted immune system. And also similar thing happening in a post-vaccination case where there is a lot of immune reactions going on throughout the body. The limitation of this is the data capture again, since the follow-up was very sparse and irregular, data capture was less. So we do not have exact data of how many of these individuals in the total groups of how many of them actually had COVID infection, if they had a silent infection or not, or how many were vaccinated. So that was not captured. So probably the impact is higher, if not the same. And also we noted a lot of these silent rejections during the COVID group, where clinically we are seeing a rejection, but patient did not have any photophobia or diminished of vision. Thank you very much.
Thank you for a nice presentation. Did you find any other factors also apart from like stopping steroid in your study, which were responsible for
stopping steroids, COVID infection, and vaccinations. So in the
so apart from these, there may be some other factors also which may be contributing.
Yes.
So
yes.
Any
no. We just looked at only these three. Yes, sir. The only problem here is like so many people had COVID infections and they are not aware of it. So that is one data we are missing. So that might actually be more. Like if
But it could be cumulative factor also, maybe other factors also, because these were not taken into consideration. But that
Right.
could be because of that
yes,
also.
sir. Yes, yes.
Thank you.
Thank you, sir.